Right now, nearly 4 in 10 adults are carrying around either prediabetes or full type 2 diabetes, and that number should stop you in your tracks. That's almost half of every room you walk in living with a condition that raises the odds of dying from almost anything, not just diabetes complications specifically. And here's the part nobody wants to say out loud. Someone walks into a clinic with vague symptoms, gets handed a diagnosis for something their lifestyle largely created, and instead of real guidance on changing that lifestyle, they walk out with a prescription and an appointment card for 6 months later to recheck a lab value. It's a strange system we've built, because the real problem was never the sugar reading itself. The real problem is insulin resistance, a process that quietly builds for years, sometimes decades, before any blood test ever flags it. It's fueled by the food environment most of us live in now: packaged convenience meals, sugary drinks at every corner, and daily routines that keep the body locked in storage mode around the clock. Insulin resistance sits underneath nearly every major killer we know of: heart attacks, strokes, kidney failure, memory decline, even some cancers. The damage accumulates in your arteries, your brain tissue, your kidneys, long before you feel a single symptom. That's the frightening part. And one of the biggest triggers behind it all is repeated sharp spikes in blood glucose. My name is Dr. Wilson, and I spent close to a decade working emergency medicine, watching patients arrive with conditions that never appeared overnight, but had been quietly forming for years. This channel exists to unpack what's actually driving these diseases and what you can do about it starting today. If this content helps you, following the channel helps this reach more people who need it. And if you already follow along, I'm grateful for that. So here are 20 practical, evidence-grounded strategies for taming glucose spikes, reversing insulin resistance, and cutting your risk of prediabetes or type 2 diabetes, even reversing it if you've already been told you have it. These aren't ranked by importance, because different tools matter more for different people depending on where they're starting. But every single one works, and every one is something you could begin today. First, build muscle through resistance work. This is one of the most overlooked tools we have for reversing insulin resistance. Muscle is the body's largest reservoir for storing glucose. When muscles contract during activity, they pull sugar out of the bloodstream with far less need for insulin, which is part of why a short walk after eating drops blood sugar so effectively. But beyond that immediate effect, carrying more muscle mass reshapes how your body handles glucose long-term, giving you more storage capacity and making your cells more responsive to insulin even at rest. You don't need to chase a bodybuilder physique. 2 or 3 short sessions a week, whether with weights, resistance bands, or simple body weight moves like squats and push-ups, is enough to start shifting things. What counts most is showing up consistently and gradually asking your muscles to work harder, because that's what triggers adaptation. Second, this is about softening glucose spikes, not banning carbohydrates outright. There's a stubborn myth that every carb is the enemy once insulin resistance shows up, but that's not how digestion actually works. Carbohydrates are simply chains of glucose, and your body handles them fine when they arrive gradually. Trouble starts when glucose floods in too fast and in too large a dose, forcing insulin to surge in response. The goal isn't elimination, it's pacing. Choose slower-releasing sources, keep portions modest, and pair them with other foods that slow digestion. You're trying to flatten the curve, because a gentle rise is manageable while a steep spike is costly to your metabolism over time. Third, watch your liquid calories. This is one of the fastest ways insulin resistance worsens without anyone noticing. Fruit juice, blended smoothies, sweetened coffee, energy drinks, even things marketed as healthy like coconut water or bottled kombucha can dump glucose into your bloodstream at remarkable speed. Drinking sugar skips chewing, skips fiber, skips any delay. It hits your stomach and absorbs almost instantly, producing one of the sharpest glucose and insulin responses possible. Even a fruit smoothie, often seen as wholesome, breaks down the fruit's fiber structure and frees up sugar much faster than eating the fruit whole would. You end up taking in far more sugar in one sitting, and your pancreas has to respond hard. That insulin surge often overshoots, dropping your blood sugar too low and leaving you tired and hungry again within the hour. That spike and crash cycle is one of the most damaging patterns for long-term metabolic health. So if you're serious about reversing insulin resistance, liquid sugar should be among the first things you cut. Fourth, think about food pairing, specifically combining carbohydrates with protein and fat. Carbs eaten alone digest quickly, sending glucose into the bloodstream in one concentrated wave. Add protein or fat to the same meal, and digestion slows considerably. Protein triggers hormones that delay stomach emptying, and fat physically slows how quickly food moves through your gut. The outcome is a gentler, more gradual glucose release. This doesn't require complicated meals, just thoughtful combinations. Toast pairs well with eggs or nut butter. Rice pairs well with fish or chicken and some vegetables cooked in olive oil. Fruit as a snack pairs well with nuts, cheese, or yogurt. These small pairings change how your body responds and help you stay fuller longer, naturally curbing the urge to graze. Fifth, stop constant snacking. This one's harder to hear because we've been told for years that frequent small meals keep metabolism revving. But that idea falls apart once you look at what nonstop eating does to insulin. Every time you eat, even a small snack, your pancreas releases insulin. Eat every 2 or 3 hours all day, and insulin never gets the chance to return to baseline. It stays elevated, and that sustained elevation is one of the core drivers behind insulin resistance. Your body needs stretches where insulin is low, because that's when fat gets mobilized for fuel, when cells reset their sensitivity, and when repair processes suppressed by insulin can finally happen. Creating real gaps between meals, letting yourself get genuinely hungry before eating again, is one of the simplest, most powerful shifts you can make. It might feel uncomfortable at first if you're used to grazing, but within days your body adjusts and hunger becomes far easier to sit with. Sixth, manage chronic stress, something that gets massively overlooked in blood sugar conversations. Stress doesn't just make you feel wound up or exhausted. It directly raises blood glucose. Under stress, your body releases cortisol and adrenaline, signaling your liver to dump stored glucose into your bloodstream. That's useful if you're in genuine danger and need quick energy. But if you're chronically stressed, sitting at a desk, or lying awake at night, that glucose has nowhere productive to go. It just circulates, and insulin has to deal with the excess. Over time, chronic stress becomes a hidden driver of insulin resistance completely separate from diet. You could eat flawlessly and still struggle with elevated blood sugar if stress hormones stay high. Managing stress isn't optional extra credit. It's core to metabolic health, whether that means meditation, breathing practices, protecting time to rest, talking to a therapist or trusted friend, saying no to things that drain you, or simply spending time outdoors. Whatever works, consistency is what matters. Seventh, pay attention to the order you eat your food. This sounds too simple to matter, but the evidence behind it is solid. Eating fiber first, then protein and fat, then carbohydrates last can meaningfully reduce the glucose spike from a meal. Fiber, especially from vegetables, forms a kind of mesh in your stomach and small intestine that slows absorption of everything eaten afterward. Start with a salad or cooked vegetables, move to protein and fat, and finish with carbs, and the carbs get absorbed far more gradually. Some research has shown post-meal glucose reductions of up to 40% just from reordering a meal without changing a single ingredient. It costs nothing and fits into any eating style. One habit my own household enjoys is slicing up a cucumber, some carrots, and celery while dinner cooks, and working through them with a tub of hummus while catching up on the day. It loads you with fiber, protein, and healthy fat before the main course even arrives, and it's become a genuinely enjoyable ritual. Eighth, protect your sleep. Poor sleep wrecks insulin sensitivity almost immediately. Even one night of short or broken sleep impairs glucose tolerance the next day. Your cells respond less to insulin, appetite hormones go haywire, and cravings for sugary, fatty food spike to compensate for the energy shortfall. Repeat that pattern across weeks or months, something common among shift workers and healthcare staff alike, and you've built a metabolic mess. What matters isn't just total hours, but consistency and quality. Going to bed and waking at similar times daily helps regulate your circadian rhythm, which in turn governs insulin sensitivity, since your body handles glucose more efficiently at certain times of day. Aiming for 7 to 9 hours in a cool, dark room without screens beforehand isn't just about feeling rested, it's about protecting your metabolism. Ninth, avoid what I call bare sugar, anything sweet eaten completely alone with nothing to slow it down. A biscuit by itself, a handful of sweets, a pastry on an empty stomach. These generate some of the sharpest glucose spikes possible because there's nothing buffering the sugar, so it absorbs almost instantly and forces an equally aggressive insulin response. The fix isn't necessarily never eating these foods. Though cutting back helps, it's never eating them in isolation. Save something sweet for the end of a meal where you've already had protein, fat, and fiber, and the sugar gets absorbed as part of a mixed meal instead of hitting your system raw. 10th, focus on insulin itself, not just glucose. Most people with prediabetes or type 2 diabetes only ever get their glucose checked, but glucose is a late-stage marker. By the time it's elevated, years of elevated insulin have likely already been compensating quietly in the background. Insulin often rises a decade or more before glucose numbers go abnormal. If you genuinely want to catch resistance early or track whether you're reversing it, fasting insulin needs to be part of the conversation, not just fasting glucose. Reference ranges vary by lab and region. So ask your doctor what's considered optimal versus merely normal for the assay they use, since a result inside the normal range on paper can still reflect meaningful insulin resistance. Routine screening in many public health systems doesn't automatically include this test, so it's sometimes worth pursuing privately if it's not offered. Catching insulin resistance before diabetes, before heart disease, before cognitive decline is one of the more valuable investments you can make in yourself. The goal isn't only a longer life, it's a later life spent healthy, independent, and free from avoidable hospital visits for things like chest pain, stroke, or dementia. 11th, cut back on ultra-processed foods, and this goes well beyond sugar and refined carbs. These are products engineered industrially for profit, containing ingredients you'd never find in a home kitchen: emulsifiers, stabilizers, artificial flavorings, preservatives. They're built to be irresistible and easy to overeat, and evidence increasingly suggests they worsen insulin resistance independent of total calories. Part of the issue is how easily they break down, delivering glucose almost instantly with no fiber, no structure, nothing requiring real digestive effort. There's also growing evidence some additives disrupt gut bacteria or interfere with metabolic signaling directly. A simple rule of thumb: if a package lists more than 5 ingredients, or you don't recognize most of them, it's probably ultra-processed. Lean toward whole foods, and, generally, if something didn't exist a century ago, it's probably not doing your body any favors. 12th, move after eating. You don't need anything intense. A 10 or 15-minute walk is plenty. Movement makes your muscles contract, pulling glucose from your bloodstream without needing much insulin at all, almost like a side door into the cell that bypasses the usual pathway. This is especially powerful right after a meal, when glucose is entering your system fastest. A walk within half an hour of finishing food can blunt the spike considerably, and doing this consistently trains your muscles to handle glucose better, even when you're not moving. It's a low-effort, compounding habit that fits into nearly any schedule. 13th, align your eating with your body's natural rhythm. Glucose tolerance isn't constant throughout the day. It's governed by your internal clock, and you're generally most insulin sensitive in the morning and least sensitive at night. The same meal eaten at 8 in the morning produces a smaller glucose and insulin response than it would at 10 at night. That's why eating late, particularly carb-heavy meals late, is metabolically costly. Your body simply isn't built to process it efficiently at that hour. Shifting more of your intake earlier, a substantial breakfast, a solid lunch, a lighter dinner, and finishing eating at least 2 to 3 hours before bed gives your body time to process food, while insulin sensitivity is still relatively strong. It tends to improve sleep quality too. 14th, get the right lab work done. focusing on markers that shift before glucose does. Fasting glucose is useful, but often only becomes abnormal once someone is well into prediabetes or diabetes. HbA1c gives a longer-term picture, and it's worth asking your doctor what range is considered truly optimal rather than simply not diabetic, since risk climbs gradually well before any official cutoff. Your triglyceride to HDL ratio can also be revealing, since high triglycerides paired with low HDL is a strong signal of insulin resistance even when glucose looks completely normal, and this ratio is sometimes referred to as a marker of metabolic dysfunction. Don't rely on one glucose reading in isolation. Ask about HbA1c, fasting insulin if it's available, and a full lipid panel, and look at the overall pattern. Catching this early can buy you years, sometimes decades, to turn things around before it progresses to diabetes or cardiovascular disease. 15th, build longer stretches each day where insulin stays low. Every time you eat, insulin rises. Eat constantly, and it never really falls. But if you define a consistent eating window, say 10 to 12 hours a day, you give your body real time to fall back to baseline for several hours. That's when cells reset their sensitivity and your body can shift toward burning fat, since insulin blocks fat metabolism while it's elevated. This doesn't require extreme fasting protocols. Simply stop eating after dinner and don't start again until breakfast. It sounds obvious, but many people snack late into the evening or start eating before they're even hungry in the morning. It can take some adjustment, but it does get easier with practice, and compressing your eating into a steady daily window is one of the most sustainable changes available. 16th, moderate or eliminate alcohol. Most people don't connect this to insulin resistance, but the link is substantial. Alcohol interferes with your liver's ability to release glucose properly, sometimes triggering reactive low blood sugar, promotes fat storage around your organs, particularly the visceral fat most tied to insulin resistance, and disrupts sleep, which, as we've covered, immediately hurts insulin sensitivity the next day. Even moderate drinking, a couple of glasses a few times a week, can be enough to stall progress if you're actively working to reverse resistance. You don't have to eliminate it entirely, though less is clearly better, but being honest about frequency and quantity matters, and recognizing it works against your metabolic goals. For some people, cutting it out completely for a few months is what finally lets other changes take hold. 17th, prioritize fiber at every meal. Soluble fiber in particular from vegetables, legumes, oats, and certain fruits slows digestion and blunts glucose absorption, while also feeding beneficial gut bacteria that produce compounds improving insulin sensitivity. Most adults fall well short of recommended fiber intake, so closing that gap matters. Add greens to your eggs, include a side salad at lunch, snack on vegetables or nuts instead of packaged crisps. It doesn't need to be elaborate, and the more consistently you do it, the more automatic it becomes. 18th, focus on reducing visceral fat specifically, not just total body weight. Visceral fat, stored around your internal organs and concentrated in the abdomen, is metabolically active tissue that releases inflammatory signals directly driving insulin resistance. Someone can be at a normal weight on a scale and still carry significant visceral fat if they're inactive or eating poorly. Waist circumference tends to be a far more useful marker of this than body weight alone. Even if the number on the scale barely moves, a shrinking waistline signals you're losing the fat that matters most for reversing insulin resistance. And resistance training, combined with cutting ultra-processed foods, are two of the most effective tools for targeting it specifically. 19th, understand where medication fits. Drugs like metformin or the newer GLP-1 medications can meaningfully lower blood glucose and reduce complications, and they're valuable tools, especially when resistance is severe or lifestyle changes alone aren't cutting it. But they manage the downstream symptoms rather than reversing the underlying cause. Metformin improves cellular sensitivity to insulin and reduces how much glucose your liver releases. GLP-1 medications slow digestion and reduce appetite. Neither reverses the root issue, which is chronic metabolic overload from diet, inactivity, stress, and poor sleep. If you're prescribed medication, take it as directed. Your doctor has good reason for it, but don't let it become a reason to skip the harder work of changing daily habits. The long-term aim should always be needing less medication over time, never more, and any changes to a prescribed regimen should only happen in conversation with the doctor managing your care. And finally, 20th, consistency beats perfection every time. Insulin resistance doesn't build overnight, and it doesn't reverse overnight either. It accumulates over years and takes sustained effort over months to unwind. The reassuring part is that effort doesn't need to be flawless. You don't have to nail every single strategy here perfectly. Pick a handful, apply them steadily, and let them compound. Small changes repeated daily outperform dramatic ones that fizzle out after a week. Walk after meals most days. Sleep well most nights. Eat whole foods most of the time. Over weeks and months, fasting insulin tends to drop, energy stabilizes, body composition shifts, and long-term risk for diabetes, heart disease, and everything tied to insulin resistance falls meaningfully. You don't need perfection here, just persistence and a willingness to play the long game. The habits practiced in your 30s, 40s, and 50s are largely what determine whether your 70s, 80s, and 90s are active and independent, or dominated by medications and preventable illness. Small daily choices rarely feel significant in the moment, but stretched across years, they quietly shape how well you age.